All right, team, welcome back to Plastic Surgery Untold, the greatest podcast in the world, as voted by us. Today, we're going to talk a little bit about Morpheus8 RF microneedling. This is one of the hottest non-invasive procedures on the market right now. It was actually the #1 most searched item on RealSelf in terms of non-invasive treatment. So we're going to get to why that is. But before we get into the goodness there, let's talk to our celebrity cast here. A lot going on. See what's going on here. Let's start this way. T-Bone, what's going on with you?
Oh, man. It's been busy. Things have been good. We actually, I alluded to it last time we were on here, but we had a little weekend trip to LA, got some tats. Listen to that last episode that we had to hear more about my stamp on my lower back. Yeah, we went out to LA, got to do a couple fun things. Did breakfast out in Malibu one day, kind of, hung out and just let our hair down for a few days. It was nice.
Sounds like you've been working hard, hitting the year off running.
That's exactly right. No, we came off the last month of the year. Was crazy for us. We've got some new projects going on up in Michigan. My partner and I do with our anesthesia group. So me and at Your Trendy Therapist, and now Your Dementia Therapist with her new business. We took off and needed to take 3 or 4 days just off the grid. So
your partner was working hard in Michigan in the snow and just like hustling, and you were out in sunny Cali.
Alex, if you're listening to this podcast, I want you to know I did work most of the time that I was in LA. But yeah, he was working hard. Like I said, we got some big projects coming up there, and just been trying to line up the troops and get everything ready.
That's awesome. What about your race career? Are you going to have another marathon planned? I noticed that you're not at the marathon today.
I am not. Yeah. So when we actually came out to the podcast studio today, all of us got stuck behind a race that we didn't know was happening. So we had to all take a 10-mile loop to get back over here. But no, my next race is going to be the Cap 10K. I'm announcing it here in the studio.
What weekend is that?
It's the 10th of April. So it's I think it's the biggest 10K in Austin or in Texas.
In the country.
Maybe
is it in the country?
The biggest 10K in the country.
Maybe we should do that.
Sure.
Yeah.
I'd be down.
Now we're talking.
Yeah. You want we can have a little race bet between Christine and I right now. See who finishes faster.
Oh,
You're
like
on,
that.
Christine. Go.
I like that.
You're welcome.
Thank you.
Gee, what's going on? You're looking fine right now. You got a little Valentine's red. You're ready to go.
Oh, yeah.
What's going on in your life?
Just feeling festive for the holidays.
Do people in the world know that you have a new puppy?
I was about to say that.
Oh, yeah, I'm sorry, dude. Go ahead.
I got a new
Tell the
puppy.
world your news.
I got a new puppy.
Wow.
I got her right around. She was my Christmas puppy.
Mm-hmm.
I got her like just before Christmas, and so now she's about 4 months old now, and changed my life.
She's already been BFFs with Winston.
Yes, she is.
Yeah.
She is. She totally is.
She's not cute at all, by the way. And if anybody is seen on Instagram, unfortunately, she's the cutest little puppy. And my wife, of course, saw and was like, "Oh my gosh, we need another." That is not happening.
Just so people who missed it, you and Mary were talking. You'd had one dog. You were talking about getting another dog. You said you didn't want a dog.
Yep.
Mary said she did, so you guys got a dog.
Correct.
Okay.
If anybody out there is married, will understand exactly how that works.
And now Mary wants another dog?
Dude, anytime she sees a cute puppy, your puppy's so cute. She was just like, "Oh my gosh, we need
should get them
another one."
together with your doggos.
Bring them over.
All right. Let's do it.
Christine, what's going on in your life?
Not much. Getting comfortable at Austin Plastic Surgeon. I've been here for about 3 months now, so I'm getting busy, getting to know my patients. February is an interesting month for me. I'm not so big on Valentine's Day, but more about the rodeo in San Antonio.
Ooh,
so I've already got my tickets for a couple of different shows. Looking for a date.
Oh yeah, 'cause you're single and ready to mingle.
I am.
So.
Hello, Austin.
You know what we need to follow through with? We never did Gilbert's episode of The Bachelor, but we should do a little Bachelorette for you because, and we should do a little poll. What's busier, Christine's med spa schedule or her Tinder date schedule? Boom, boom, boom.
Not about
gonna be
Tinder.
a little...
Bumble's where it's at.
Bumble. Okay.
Yeah.
Okay. Awesome.
But,
well, we need to follow up with this because we'll have a bachelor and a bachelorette.
I'm down.
Okay.
Yeah.
All right. Well, those of you listening, Christine's ready to single mingle. What's your criteria for the lovely suitor? Because they,
Must have a job and love his mother.
Oh, wow. Okay, cool.
That's it.
Yeah,
Simple.
number one is JOB, job. Boom. Sounds good. Well, team, we're with me. Nothing too much else
Yeah,
going on.
that
With
was my
Winston
next
and I, working hard. He was at the office last weekend, helping me prepare a presentation, mostly passing gas. But other than that, he was living life. And then I got to hold this nugget a little longer, but there is something hopefully coming soon, about 90% of the way set for those of you that live in San Antonio. So we'll leave that
Ooh.
little nugget there. And
I like a good teaser.
Let's jump into a little Morpheus. Who wants to tell us about Morpheus8 and why this is so hot?
I'll
Both
go.
our bachelor and bachelorettes are speechless. They're probably just worn out. We do tape early on Sunday morning. They're probably on
Probably
big
last
dates
night.
last night. Just thank you for making it up. Appreciate you
Yes.
packing an overnight bag.
My date was with my laptop coming up with the scripts for today's episodes. That was how I spent my Saturday.
None like the last minute.
Tell us what is Morpheus8?
So Morpheus8 is radio frequency microneedling. So I think we've spoken about microneedling on several episodes in the past, but with Morpheus8, we're adding the radio frequency energy to that aspect of treatment. So essentially what we're doing is we are making teeny tiny little puncture wounds into the skin and then sending energy, radio frequency energy, into the tissue and creating a controlled injury, which in turn helps stimulate collagen production and elastin, which helps with a lot of different things, a lot of different aspects of the skin, from skin laxity, helping with fine lines and wrinkles, helping with pore size, a lot of stuff that we can get into in more detail. So.
And I think this is why it's gotten so popular, because if you guys remember, Skin Pen's been around for a while now. And that was super popular because you could treat a lot of different skin types. You could definitely treat some of these contour stuff without the huge amount of downtime that some of the traditional lasers had. And so that was super exciting. Now this kind of is combining some of these different worlds and really getting you the best of both worlds. Because if for those of you that listen and follow us on Instagram all the time, our Renuvion J Plasma is a radio frequency energy. And that's how that does the skin tightening, a little bit stronger, a little bit hotter. This goes under the skin completely, but also a little bit more downtime. We tend to be doing a combination with our liposuction. So this is getting you some degree of that radio frequency energy that does the same skin tightening, getting you some of the skin contouring. So it's these merging of these two technologies has really made this super popular.
Yeah. I want to say Skin Pen still has its place. I still love that treatment for fine lines and just rejuvenating the skin, anti-aging. But the microneedling, it has the radio frequency, so you're delivering the heat at the same time. It's also going 4 millimeters into the skin versus 2. So the Skin Pen is just going 2 millimeters. So it's going a little deeper. I like this better for acne scars, like the pitted acne scars. With the Skin Pen, it would take a lot of treatments to get the results you'd get from 3 Morpheus treatments for that. So I'm excited to use that for acne scars and stretch marks too. So, yeah.
Since you bring that up, let's talk about it. Maybe just kind of work our way from head to toe. What things can be treated? What's a good area to treat with Morpheus8?
So we can break it down into just the eye area, just around the mouth for deep lines and wrinkles on the mouth, and then also full face, neck, décolleté, arms for skin laxity, inner thighs, abdomen. I've seen some before and after photos on the Morpheus website of back, like loose skin on the back. So
I feel like you're jumping so fast.
I'm sorry. There's so many areas.
So for the face,
let's do the face
focus.
here.
Let's focus on the face. So
Christine's ready. She's like,
she's just super
I just wanna
excited
treat
about
everything.
it. Super excited.
she wants to lift my big toes.
So there's a lot of things that can be addressed on the face alone with Morpheus8. I think Christine alluded to a lot of it. I mentioned some earlier, from enlarged pores, fine lines and wrinkles, mild to I would say very loosely moderate jowling of the face. It helps kind of tighten that up too. I think with the right patient, you can get some really, really amazing results, but it has to be the right patient. You can get some definitive like skin tightening, like she mentioned, around the eyes or on the mouth. Those are some really great areas to treat, because sometimes some patients have some not only like fine lines and wrinkles around the eyes or the mouth, but they also have some some laxity to the skin that could benefit from tightening, things that maybe something like Botox may not address alone. And so combining radio frequency with microneedling helps tighten up the skin around there and can also address some of those fine lines and wrinkles.
And those areas that I love, because those are areas that are really hard to treat with surgery, right? You know, so around the eyes, especially the lower eyelids, and something maybe we'll circle back with Dr. Weinfeld about. But, you know, if you take too much skin from the lower eyelids, that can cause a whole host of problems that are really hard to fix. And so, and that's an area, you know, especially in this world of masks and stuff right now, that, you know, that's your, you know, what do people say? That's
the eyes are the window to the soul.
Exactly. Boom. Thank you, sir.
Yeah.
That's why you're our quote expert. Boom. But around the eyes, that's an area that's hard to treat with surgery. No question, Botox can help, you know, soften some of those wrinkles. But tightening the skin around the eyes is, I think, a great one that's really tough to treat with surgery. Around the mouth, Botox can soften that. Some people tolerate it well. Some people don't around the mouth. Those fine wrinkles, you know, we used to, and they have such a negative stigma around, because traditionally the wrinkles around the mouth were caused by smokers. You know, but that's not true. That's not, well, it is true, but it's not the only cause for those lines around the mouth. But some people don't like it because it has that stigma. Also, some people just don't like it because it doesn't look great and can make you look a little prematurely aged. But you can get it from straws. Some people just get it from natural motions they make of their face. You know,
pursing their lips.
Yeah, or, you know, a lot of Instagram kissy faces.
Yeah.
Christine's been doing this all over the gram, you know, on her Tinder, like kissy face. So, you know, we may need to do a little RF microneedling around her mouth, but I think those are great.
I think it also, like Christine said, it works amazingly well for acne scars. We get a lot of patients. I come from a derm background, so I would see this quite a bit. And there are some really deep scars that can occur from acne, deep pitted scars that sometimes chemical peels and regular microneedling just aren't strong enough to attack. So I think that's a really great aspect to treating with the Morpheus. You know, being a surgical practice, you know, we have some patients that get facelifts. I think it does a really good job for some of these post-surgical scars too, for like facelift patients. I think it can really help minimize the appearance of some of these scars. I think that's another avenue to consider.
And I think this is one of the things that people sometimes get confused about, because it's like, you know, which one, you know, which one's better, you know, a facelift, you know, Morpheus8, the RF microneedling, you know, and stuff. And it's not really one's better than the other. One, it's what do you need?
Yeah.
Two, you know, because a lot of people do combination therapies because, and we've talked about it in the past, you know, doing a facelift, if you pulled somebody so tight to get rid of all those fine lines and wrinkle stuff, I mean, you would look so windblown and crazy. It just wouldn't look good. And so the idea is that facelift gets, like we've talked about the other stuff, gets rid of the skin laxity, sometimes can restore volume with fat transfer, depending on how you're doing some of these things. But also the RF microneedling helps that contour, the skin texture, you know, surfacing. It's basically polishing that car. You know, it's not going to change the foundation, but polishing, you know, that face and getting you into a great spot. And then the RF definitely helps if you're not quite facelift ready, but you got just a little bit. Sometimes even if people have had a facelift 5-7 years ago and they still look fabulous, but just have a little tweak, because unfortunately there's no surgery that stops time, right?
Yeah.
You know, we turn the hands back, but, you know, just doing a little bit of tweaking helps either prolong when you need some type of revision or secondary procedure, or sometimes can just keep you completely from being able to do that.
Yeah, I was going to touch on that. It's
No,
great.
please touch on that.
It's
Sorry.
great
Stole your hand.
for you did. It's great for preventative. So I don't think there's an age limit on this. Surgery, like you said, lifts the skin and helps with the sagging, but the RF and the microneedling will help with the texture, with the pores, some discoloration. So I think it goes well with all the other treatments that we offer. And then, yeah, maintenance, doing it once a year, or that's what they said, right? Three treatments, and then maybe once a year for maintenance.
Because time doesn't quit marching on.
Yeah.
The other place, and you mentioned the neck, décolletage, upper chest area. I love those areas because a lot of people come way down and they point to like where their neck meets their chest, and I tell them in a face and neck lift, those areas aren't going to get better. You know, the stuff underneath the skin, just from a safety standpoint, we don't go all the way down to the chest on your neck lift. But so sometimes you get the stuff right under the jaw, you get that defatted, you get those muscles tight, you get that lift with a facelift, but then you're left with, you know, this low V cut, you know, crepey stuff, you know, in the clothes. And that's just another great area that can be the finishing touches in your facial chest neck rejuvenation.
Yeah.
See what I did there?
I do.
Because we all want to be tight and right like T-bone.
Yeah. That submental area is really good too because, you know, and we've talked about this in the past with, the, you know, liposuction, Kybella, stuff like that. Sometimes it's not like a fat pocket. It's skin laxity and you know, using RF microneedling for, you know, that area, I think would be a game changer for a lot of people.
As we keep working down, what else is it good for? So we've talked about face, acne scarring, skin blemishes in terms of that, doing some skin tightening, neck, jowls.
Even some pigmentation changes, like some pigmentation changes from sun exposure, hormones, things like that can be improved upon. Maybe not completely eradicated, but improved upon with the microneedling.
What else as we kind of work down? How about body stuff?
Yeah.
What is RF microneedling great for in terms of body stuff?
You wanna take this one?
So I've used Morpheus8 at another plastic surgeon in the past, and I did a lot of stretch marks on the breast area. We treated the arms, and especially, you know, people are always worried about after lipo, cool sculpting, any fat reduction from the area if they were going to have loose skin. So a lot of times we'd come back with Morpheus and tighten that up. What else? Arms, back.
I think stretch marks is a big one to touch base.
It's
Let's not skip over that.
Yeah.
Remember, we're not going to 100% get rid of stretch marks. And then, you know, depending on where you are in the stretch mark category,
Exactly.
and I give you a little teaser for a future episode, there's multiple ways to treat stretch marks depending if it's the redness or color or if it's the contour and the skin laxity stuff. So we're going to talk about contour, texture, skin laxity for now. Something coming for the color soon. But touch base on that because it's not going to 100% get rid of it, but improves it.
No. And from my understanding, stretch marks, the skin's been tethered, so it's kind of hard to put it back together. But what we're trying to accomplish is the texture being softer, the skin being tighter, and then, again, combo treatments for color. Because, there's white stretch marks, pink, brown. They come in purple, all different colors. So
It goes through like a whole life cycle. Starting off like really dark, like violaceous purple kind of look, and then down to like a reddish color, then down to a pink, and eventually a white color. And, you know, the older the stretch mark, the more challenging it can be to get rid of. Not impossible, but just a little bit more difficult.
Yeah.
But it'll be interesting because I actually love, you know, when we do tummy tucks, a lot of times people, depending on where those stretch marks are, sometimes come all the way up. And so we'll do a tummy tuck. They still have skin laxity. I love to come back afterwards, treat them with Renuvion J plasma because that radiofrequency energy really helps tighten that skin. Again, doesn't get rid of the stretch marks, but changes that because when they stand up straight, there's no skin hanging down anymore, but they just have this loose nature to the stretch mark stuff. You know, unfortunately, most people don't necessarily want to jump back into another surgery. So it's limited how many people we've been able to treat with the Renuvion J plasma for that. So I'm super interested to see over time how many people we can treat that have a little bit of that, don't love it, just want to be a little tighter in that area. So as we follow people over time, I'd love to see how much this is going to help people with some of those issues. Because I think it's going to help, but just try to be realistic. You know, if you're can't compare it to a surgery, but you know, a lot of people, I'm not ready to do surgery, you know, doing some stuff.
And they're just looking for an improvement.
Yeah.
I think a lot of stretch mark patients understand that. We're not going to get rid of them 100%, but we can definitely improve the texture and lift the skin. Yeah.
And smoothing some of that out right at the tummy tuck area, you know, because that's where some of those stretch marks a little bit are left or way down right at that bikini panty line. And they just want to just smooth out just a touch to get into that two-piece to be, you know, hot girl summer 2022.
Yeah.
Can we talk about knees and elbows? Because I think that's a really great area for
please,
RV.
because I'm ready for bikini season 2.
Yeah, RF microneedling.
Yeah.
I think one of the areas that sometimes gets overlooked are the tops of the knees and around the elbows. There can be some significant skin laxity there that can make us look older than we may be. And so with RF microneedling, we can tighten up some of that laxity with the heat and the energy and kind of restore some of that youthful look to these areas. And I know, you know, people may think, that's my knees. Who's going to look at my knees? But, you know, for some people, that's their biggest concern. You know, they may come in, you know, with really loose skin on their abdomen, but they come in because they want their knees looked at. And so it's like, you know, everyone has their own thing that they focus on.
And knees are another great one just because that's not one that we can really treat with surgery. I fight people because don't want to do really scars across the joints. You know, it's not an area that you're going to be able to hide those scars well. And so very difficult to treat with surgery. And so I think any improvement typically is going to be super beneficial because you have a big scar there. I don't know that we've net gained them anything. You've traded one thing that you don't like to see for another.
And then sometimes even doing this in combination with, some biostimulators like dilute radius to help kind of stimulate more collagen production. And that's a topic for another day. But, I think these are things that we can explore and help our patients with.
Awesome. What about the treatment itself? Is this something that again we need celebrity anesthesia, or is he gone by the wayside? We don't even need him anymore. I feel like we phased him out of most of our episodes here.
I think I can save you some money.
Yeah. Because most people do well with topical anesthesia. Is that correct?
Yeah. So most people do just topical anesthetic. We also have our Pronox available at the office, which is great for me now because this was not something I had available at my previous practice. So it's a great adjunct to making the patient more comfortable.
Can we just talk about downtime recovery? Because I think that's a big question for people. How long do I need to be out of the spotlight? Can I go back to work the same day, the next day? Am I going to be red like I am with some of the traditional lasers? Where do people fit with all those things?
Christine?
Yeah, I was going to touch on the pain aspect too.
Yeah.
We do, again, try to keep the patient comfortable. We've got Pronox, we've got really good numbing cream, and then I've got a really nice mask that kind of takes the redness out of the skin at the end of the treatment. For downtime, the nurses were saying up to 2 weeks of redness, but we treated a couple of staff and family members, and I would say 48 hours, 72 hours, maybe. But my mother looked great the next day. She had little pinprick marks, but she was not red, sunburned. So I would say 48 hours, no makeup, no retin-A, no sunscreen, nothing irritating. 72 hours, you're probably back to being able to wear makeup and using your regular skincare. So I think with the body areas, because we are going deeper, you're going to be red for a little longer, maybe a week.
So no hippie hollow the next day. Is that what you're saying?
No, I don't even want my patient going to HEB right after the treatment. I just want you going straight home because we put sunscreen on them maybe, but just to get home, and that's it.
Yeah, and that's because, we're creating these little puncture wounds into the skin. And so, one, we don't want to put anything that is like a foreign body to the skin, like makeup, that can get into the tissue and then create reactions or, risk for infection, things like that. So, that's the main reason behind not putting anything on the treated area for, the amount of time that we recommend. And then, of course, with sun exposure, like we were talking about, we don't want to risk any hyperpigmentation from reaction to the sun with these little controlled areas of trauma.
So to summarize, who would be a good candidate for this? So it sounds like anyone that has some facial contour stuff, whether it's acne scarring, whether it's just some fine lines, wrinkles, someone that maybe wants a little bit tighter skin, but these people are in overall good health. Is that? Would you say that's pretty fair for the face of who would be a good candidate?
I think anyone who's in good health is an excellent candidate. One of the beauties of this treatment is that, again, we can treat all skin types. Everyone is fair game for this treatment, from someone who's very fair complected to someone who's much darker. There's no risk. Well, I shouldn't say no risk, but there is very minimal risk for any kind of hyperpigmentation as long as you follow the recommendations that we give you with your post-procedure instructions. I think the risk of any kind of hyperpigmentation to the area is very, very low.
And this is where we'll help guide people, because I don't want to mislead people. This isn't a replacement for a face or neck lift. It's not to the same degree.
Not at all.
This is bridging that gap if you don't need the full surgery. This is fine-tuning if you've already had a surgery.
Right,
Yeah.
right. And I think texture stuff, again, I'm super excited to see how this does for acne scars and even acne, active acne. There's something about the heat and the radio frequency that helps kill the bacteria. So we saw some really good before and afters of active acne patients after Morpheus, and it looked great.
That's awesome.
So yeah, for me, it's, we see a lot of texture, big pores, like sebaceous, oily patients that have been loving the Aqua Gold, by the way. Thank you. The Morpheus, they'd be great for that too, for more of a, I don't want to use the word permanent, but more of a longer lasting pore reduction texture goals.
And I've even heard some patients post-treatment, like maybe like a week or two post-treatment, come back and report to us that they feel like their makeup goes on a lot smoother because of the treatment and stuff. So it does, to Christine's point, have a pretty impactful role on skin texture.
So that seems like a good benefit for celebrity, because with all of his selfies, something that's going to maybe take that glow off,
Right.
let him look
100%.
a little bit smoother, nicer, not so many filters needed.
100%. It's like a natural filter.
No filter needed.
Yeah.
Hashtag, you're welcome.
I want to look like porcelain, like a porcelain doll.
Yeah, there you go.
And so just so people know what to expect, if somebody was doing like their full face, how long would that procedure take for them?
I think once we master it, it's just coming from experience, the full treatment should take an hour.
Okay.
From numbing to doing the treatment to clean up to explaining the take-home products. Right now, because we're a little newer, maybe an hour and a half, just to kind of talk about it and, get comfortable in the room. But yeah, no longer than that. I mean,
Well, we want to make sure that the patient's fully educated too. So we want to take our time to explain the whole procedure to the patient and make sure that they are comfortable moving forward, make sure that they have all the information they need, all their questions are answered so that they walk away knowing that they had the best experience possible at Austin Plastic Surgeon.
Perfect. And then any other take-home stuff you want people to know about Morpheus8? So don't need celebrity to be just topical anesthesia.
Yeah.
If people are struggling, need a little something, and most of it's anxiety. Then we do have the Pronox. Most of the time, once we get started, people don't even need that.
Yeah.
What other take-homes would you guys want people to know about Morpheus8?
I would say the recommendation is to have a series of 3 treatments done. In sequence or in series, and then once you've completed that, you can do kind of like a maintenance treatment for years to come. To be quite frank, and maybe do like one maintenance treatment every 6 to 12 months, just depending on your skin type, how well you tolerated the treatment, what kind of results you got. Someone may want to come in twice a year for one. Someone may want to come in only once a year. And honestly, I think if you can keep up with that maintenance, the results that you get are something that can be long lasting.
And a lot of those spectrums, it's almost hard to give people an exact number because it depends on how you take care of yourself.
Yeah.
If you don't use sunscreen, if you're smoking, if you have a lot of yo-yo dieting, up and down weight loss, all those things affect your skin. So that's why everybody's so different. And this is the reason getting on a good moisturizer, on a good sunscreen, because those little things are helping bridge the gap for some of these little bit bigger stuff.
Yeah.
Those little bit bigger stuff are the things that help bridge the gap and protect you from needing a secondary facelift or maybe prolonging when you need one. So I think it's the whole spectrum that goes together and it just works its way up that pyramid, doing the small little stuff that are inexpensive early on in life and consistently are going to help decrease what you need later on.
Yeah. I wanted to say too, as far as taking care of your skin, part of it is education. So, we definitely want the patients taking home good products to use because I don't know what they're going to put on their skin when they get home. So we'll definitely talk about that. And then, back in the day, we used to want patients to prep their skin before any of these treatments. We'd get them on a good antioxidant for a few weeks, a brightener, back off the Retin-A. I definitely need my patients not to be using Retin-A before this treatment. And then, just whatever products you're using at home, getting them to use something that's going to keep the results lasting. And then I had something else to say about the Morpheus. Come back to me.
Okay. Can we do a little behind the movie? What's a little nugget that people probably don't know about RF microneedling? I feel like you guys have already dropped so many nuggets. One of the ones you guys had mentioned to me before is actually treating surgical scars. Like if somebody has a tummy tuck incision or that they want a little bit smoother, a little bit finer, you can almost like instead of the old day where he did like the dermabrasion stuff, you can actually just smooth it out just little by little.
Yeah, surgical scars are a great treatment option for the RF microneedling for Morpheus.
You're welcome. I had to do behind the movie too.
Yeah.
I mean, I liked it.
I mean, it is your show.
Can we do? It's our show. It's our Plastic Surgeon Told, our theme. What about a quote? Can we do a quote?
I got
Since Gilberto's been carrying us.
I'm taking over today for G. This is from The Rock.
Oh, I can smell what you're cooking.
Yeah, I don't know if you're watching at home. You just got to see my rock eyebrow. It's a little.
Check us out on YouTube.
The disc sport's affecting it. So that's all I got.
I want to just to piggyback on that. I want to Botox just one eye so I can do the people's eyebrow.
There you go. So this is from Dwayne Johnson, aka The Rock. Success isn't always about greatness; it's about consistency. Consistent hard work leads to success. Greatness will come.
Boom.
I love that.
I do like that. There's no quick fixes, and I think we've talked about this. It's a process. It's maintaining this, and so I think super, super important.
Both of you guys alluded to consistency with this, and I think the biggest thing is, having to get consistent or to get good results. It's all about consistency, good skincare routine, having a good schedule to actually do the treatment protocol that you guys are prescribing. It all ends up with being consistent yields great results.
And I think this is where finding a provider that's going to go down that journey with you, because there's a lot of steps, a lot of things to go through there. And it's funny because we'll have people that come in for RF microneedling, for Eon, for, lipo, and that's not the treatment they need. And somebody that's going to help you through it whenever you're ready for some of these things, and kind of just getting you in a good spot. Christine touched on it. I see so many people that have so many products. They pick up something different every time they go through Nordstrom's, Macy's, wherever you Target, Walmart stuff, and you got so many things. You just kind of like try things every day, and there's no real, rhyme to what you're using. So having a few quality products that you're using consistently and appropriately is going to go so much further for you, and you're probably going to end up spending less money.
Yes, in the long run.
Totally agree with that. And to bring that home, we talk and joke about the Groupon, $6 a unit
Anesthesia?
Botox
Oh.
and Groupon anesthesia and Groupon facials and stuff.
I thought I saw your picture on Groupon.
That
It
was
was kind of cool. I was like, that's a good picture. That's a good picture.
No, but I think, with that, if you're just hopping around and you're going to 15 different places and you're getting Botox and Dysport done by 20 different providers, and there's no consistency, there's no clear communication, you can't build out a plan. And that's one thing that I think you guys at Awesome Plastic Surgeon do so well, is it's this team approach, it's this guided approach to, you've got surgical options, you've got non-invasive options, you've got, mini invasive options. Like you kind of have everything at your disposal, and your team sets a great plan in place with these patients, from Christine giving, skincare advice and what products, to you helping guide people through, lipo and actual surgical cases. So
Any
you
last
get what you pay for.
Morpheus8 take homes?
We've got a couple cool things in the office for post-procedure, one of them being the exosomes.
Ooh.
I really want to talk about that here one day. But this is supposed to speed up the healing process by 50%. So, we want the skin dry when we're doing the radio frequency. I, clean them up afterwards, put a little something special on there, PRP, exosomes, hopefully being one of them. I think that'll be great.
And if you're single and want to mingle, slide into Christine's
Bumble.
DM.
Bumble.
What's your handle? The
She's not.
the Skincare Diaries. You're welcome.
Yeah,
people.
thank you.
Gilbert, Pete, what's going on with you?
I thought he meant Bumble.
I think this is a great addition to the practice. I cannot say enough amazing things about it. I'm super excited to, start seeing the results that patients are getting from Morpheus. Also want to tease for a future episode an additional aspect to our Morpheus platform called Optimas, which is going to help our patients with some other skin conditions. So stay tuned for that on a future
leave us
episode.
hanging. Okay, cool.
Love it.
T-Bone, what's going on? Any take-home messages?
I want y'all to come see me more in the operating room. No, I mean, I just think this is a great tool. It's another tool in y'all's tool belt. It's going to be, it's one thing that can address some other, skin texture issues and things that other stuff can't. So.
Perfect. Well, I appreciate everyone listening, tuning in to Plastic Surgery Untold, the greatest podcast in the world, as voted by us. Don't forget, you can listen to us anywhere you get your favorite podcasts, iHeart, Spotify, Pandora, iTunes, and then we're also on YouTube. So if you want to see our pretty faces, please hop on there and stay tuned for more episodes. See you guys soon. Bye.
Bye.